Welcome back to Living 757. June is Post-Traumatic Stress Disorder Awareness Month. And while most people have heard of PTSD, they don't really know too much about it. Well, we have a friend of the show who we're lucky enough to have in studio today, Dr. Elizabeth Fedrick. She is going to help break down PTSD for us. Hey, Liz.
Hey, Ashley. So good to see you.
It's so good to see you. Usually we're so far away. It's so nice to have you in the house.
It absolutely is. Happy to be here.
Okay, so like I said, PTSD is something that most people have heard of, but there are a lot of common misconceptions. So let's break it down to the very beginning. Okay. What is it and who can it affect?
Yes, so great question. So post-traumatic stress disorder is a disorder that impacts somebody who's experienced a really heightened traumatic experience. And so trauma is very subjective in nature in general. And so something that might impact somebody one way, maybe won't impact another person a different way, right. But it's really how it impacts the individual. And so with post-traumatic stress disorder, you have to have certain symptoms that take place for at least a month for it to be diagnosed that way.
Okay.
And various, symptoms that come along with avoidance, hypervigilance, things of that nature.
Okay, now you said symptoms. So what are some of the signs and symptoms that people can look out for in themselves and in their loved ones?
So signs and symptoms of PTSD include nightmares, really common, flashbacks to the event, irritability, changes in mood state, so increased depression, anxiety, irritability, and really, as I mentioned, a hypervigilance of those type of situations. So it's really avoiding the situation that led to the traumatic event,
okay.
Or thinking about it obsessively.
Okay. So this seems really serious. It seems like something that for those affected, it really can take over their lives.
Yeah.
Can it be cured? I don't know if that's the right word, but is there any way to kind of break out of that state?
Yeah, and that's a really important point. It really does take over their quality of life, their daily functioning, and it can happen to really anyone at any time depending on the situation. And can it be cured? Yes, it can be treated. So cognitive behavioral therapy, trauma-focused CBT, eye movement desensitization and reprocessing, those are a couple modalities that are really effective for treating it.
Okay.
There might be some lingering triggers that last, ongoing, even throughout the lifespan. However, the really overwhelming nature of it can certainly be treated.
Okay. Now, can children experience this?
Absolutely.
And if so, okay, so they can.
Yes.
Now, can the triggering event happen when they're a child and the PTSD kind of present as an adult?
Absolutely, and likely it presented throughout childhood, adolescence, and into adulthood. But if they don't have somebody who's aware of it, who's cognizant of those symptoms, it may very well go left untreated, which is really impactful for somebody's quality of life.
Yeah, definitely, especially if it's starting from such a young age and then having to live without any kind of help or treatment.
Yeah.
What sectors of people do you think are the most affected by PTSD?
So you really can't define it that way. You can't specify because it might happen, veterans or individuals who've been in the military. It's very common. We hear about that a lot. But also abuse is a very common reason for this. Car accidents or major life disasters. Everybody is susceptible to PTSD.
Okay. And if you are dealing with PTSD or your partner is dealing with PTSD, what is the best way to be supportive to someone going through that?
Really validating their experience or your own. So having compassion for it, being aware that it's a real disorder and it is really detrimental and can be incredibly overwhelming for people. And so not minimizing it, not dismissing it, but really recognizing the toll that it can take and then providing validation and support. But then also, whether it's yourself or a loved one, mental health help is crucial. So reaching out to a mental health professional is the most important thing you can do if you realize this is what's going on.
Okay, that was going to be my last question. If you or someone else who's watching right now thinks, oh my gosh, I have all of these symptoms, what are the first steps that they should take to getting better?
Yes, so the very first thing would be to seek help. And I understand that's not accessible to everybody. So if not, really trying to find resources that are valuable, coping skills, ways to manage it. But psychologytoday.com is a great resource to find. You can really filter through what you need, and that's a great way to find somebody who can help.
Awesome. Now, where can people find you and more information on you, because you put out so much great content?
Oh, thank you so much. Yes, my website is drelizabethfedrick.com. I'm also on Instagram at Dr. Elizabeth Fedrick.
Awesome. Well, thank you so much for joining us. It's always a pleasure.
Thanks, Ashley.